comes to illnesses, doctors look at men and women differently, even if they have the same diagnosis. In today's Healthy Living House Call, sponsored by Florida Hospital, Dr. Lori Boardman is here to talk about gender-related medicine. Great to see you. Thanks for coming in.
Thank you so much.
Now, you're the Chief Medical Officer and Executive Medical Director of Women's Health for Florida Hospital, so you really get to see a wide range of what we're talking about here. Why is it so important that men and women are treated differently, even if they have the same diagnosis?
Well, Amy, what we know about medicine and what we've come to learn over the last decade, the last 2 decades, is how differently men and women can be with respect to how they present with disease, how they respond to medications, even how we test patients. We had to rearrange how we did thyroid testing because we realized levels were different in women than they were in men. So that's just the tip of the iceberg of the things that have happened over the last decade.
We've heard a lot about why women's health matters, how important it is. Why do you think that women's health is so different versus men's health?
I think down to they'll say the cellular level, down to our DNA construct is different. And what we know is that a lot of the testing and a lot of the studies in the past have been done using male rats, using men as control subjects. And as we've come to incorporate women more into trials and into even basic science research, we're beginning to see those differences become obvious. So hormonal influences, but biological differences really distinguish men from women. Not all the time, but enough that we really need to focus on it.
What about mental health issues? What do you want the folks at home to know about the differences there?
Mental health issues are highly pervasive in our country and in society in general, but we know that women, more than men, are more likely to experience anxiety, more likely to experience depression, more likely to experience post-traumatic stress disorders. So what we're trying to focus on is times in women's lives when mental health plays an enormous role. We know that in pregnancy and in that postpartum period, that's the period of time when women are really most susceptible to mental health conditions. One of the things Florida Hospital for Women is working on is developing a program that targets women with perinatal depression, so depression or anxiety that occurs during pregnancy or in those even up to that year postpartum. That's the most underdiagnosed condition of pregnancy, and we're really focusing on developing a partial hospitalization program to start to take care of women.
Wow.
And address this for our community, because it affects about 15% of women.
Wow, that's fascinating.
It is fascinating.
All right, you're going to be sticking around, right? Answering
Yes,
questions from our viewers. So
Absolutely.
Dr. Lori Boardman, she's great. She's going to stick around. She'll be answering your questions. If you have questions for Dr. Boardman, all you have to do is go to our website, fox35orlando.com/health. Post your question there. She's going to be very busy typing away. So look for her. Thank you so much. And we'll check back in with you in just a little bit. Didn't she do great? Did great. We do want to check back in with Dr. Lori Boardman right now, Florida Hospital for Women. And you've been getting some great questions from viewers. We're curious to hear what kinds of questions you've been answering.
Hi, Amy. I got a lot of great questions. A lot of follow-up on the mental health issues with with women writing in about depression after the loss of a loved one or how they can get help for their postpartum depression. Also, a lot of questions about cardiac screening, polycystic ovarian disease, osteoporosis screening, and a lot of good questions about why those differences appear to be different in men and women. So a really robust number of questions that we had a chance to answer this morning.
That's wonderful. When it comes to choosing a doctor, should you look for doctors who are very specific to yourself, as in, this doctor is really good with women's issues or men's health issues?
I think it's best to find a physician that you're very comfortable with and that you have a trusting and open relationship that you can get answered the questions that you really have. So I do think that finding that person sometimes is a person that's specific to men or to women that have that expertise that you're looking for. And when you go to talk to those doctors, you want to take a list of questions that you want to get answered. And if those questions are answered and you feel comfortable, that would then be a good match.
Absolutely. Well, we certainly appreciate your time and your expertise today. Dr. Lori Boardman with Florida Hospital, thank you so much.
Thank you, Amy.